Okay, so we're fitting for the Serola belt at this stage. So we got top iliac crest. Okay, it's greater trochanter right there. So it goes kind of right in the middle. So I kind of line that up with the pants. Always kind of come here and here, snug it in. Okay, go ahead and grab it. Okay, go ahead and put it on. So I always tell people put on kind of snug. Doesn't really matter if this is facing upwards.
Isn't that too high?
No. It's right on it. No. Okay. Go ahead and grab these two. Tighten it down. Crank it in. Just pull your pants lower, that's all.
Right.
Trying to be younger, I get it. The kids are doing these days, right?
Yeah.
So
not me, I'm not one of the kids.
So, not anymore. But no, so from here, if we had any problem with ranges of motion, so go bend over, touch your toes. Okay. So normally if there's any type of discomfort or something, that's where we kind of see some form of relief or improving range of motion. You're obviously having active pain, so we can't see that. But we did some testing, so lay on your back.
So this is basically an example of forced closure, right? Okay.
And so go ahead and lay on your back for me, please. But this is where the function tests kind of come on in, because a lot of times when you're doing like the psoas, you know, or the faucet test, the thing is that you can go so straight and like that for me. So the ring kind of come back on up with the faucet test. Come soft fist. I'm gonna pull to the foot. Okay. Hold right there. No, I'm gonna pull to the foot. Don't raise it. Hold right there. Hold. Good. So, can you tell the difference with that?
Yeah, good. More strength.
Let's go the other side through there, and kind of pull over here. And again, real life you wouldn't. You go across the body with that.
Okay.
Same thing with the psoas as well. So if we come up over here, hold strong right there. Only push on down. And then kind of pull it to iliacus. Hold right there.
What'd you call this?
Iliacus. Hold
oh,
strong.
okay.
So it says you can see the facilitation there.
Yeah.
Then to come over to the QL. Yeah, this. A little cramped here, so it's not the best way of doing it, but that's okay. I'm going to fold the feet over towards me.
Okay.
Okay. So as you can see, you can hold a lot better.
Everything moved and was weaker before I put the belt on.
So for testing, because you get some people who pay attention to what's going on, you know, and if they have the weakness, you put the belt on and it truly is instability. Like, oh my God, it feels amazing. Look at that. But you do get some of the people that are, well, you're pushing harder, you know, this and that. Yeah. So the thing is you can easily kind of just take it out, because relax this leg on down. Relax this leg on down. Hold the foot out here. It's for basic psoas test. Hold. So from here, don't move anything. Everything's still.
Okay.
We just kind of take the pressure off. Okay. Depending how tight it is, sometimes you can take this off as well. Okay. And then from here, hold strong. Don't let me push on down. You can see it.
Yep.
Come on, give it to me. Give it to me, tough guy. Give it to me. You know. So the thing is, you get some real time stuff right off the get go.
Yeah.
So since we didn't really move much, if we can kind of pull this on, you know, tighten that down a little bit through there. Okay. You can
These
test
two
it.
or no?
No, just that first.
Oh, okay.
Hold strong, hold. So you can see that's not. There's maybe a little bit of increase in strength in there, but not much.
Yeah.
Let's get the two little wing things on there. Again, we might actually fit more of a medium, but anyway, hold right there. Push. So you can see the facilitation right off the get-go.
Big time. Because you're basically simulating what the multifidus and the transverse abdominis should be doing, right? You're giving it core stability.
Oh yeah.
Yeah.
So we use this in conjunction with some AK, some chiropractic, SOT, you know, the whole line, you know, rehab, the whole 9 yards. Yeah. And then you can facilitate, and by using the belts, it's made a lot of my progress shorten down rather drastically. But you know, most important thing is if you do this from like as soon as you're seeing somebody, like day one type of things, you can actually get some really good changes day one to make a good impression. Right. Already start making those facilitation changes. But instead of having to wait, you know, like a month, 2 months, 3 months for them to get some really good range of motion results, they can do it right off the get-go. They can wear it at work, so they can protect them at work, feel much better. And then when you're adding, you know, some of the that's like the stabilizer that we were using. Yeah. You add that to it, and then you can kind of get the coordination of the core under control. Yeah. And you can see, I've had some really good chronic cases that I've been struggling with that we started putting on this type of protocol, and they come back and it's like, dude, this stuff's like, it's not awesome. It's like life changing. It is amazing. So that's why I've been using these things left and right, is because I start catching on. You know, actually a lot of people who have been going to chiropractors on a regular basis. And so the thing is I don't want to say that in the video, but you know, the people have been going from hopping from one to next to next to next to next.
No, that's a good message actually for people to hear, because a lot of doctors don't know why patients go away. Yeah. And it's because
they never hear, but they go away because they get better results somewhere else, or they didn't get the results they expected, and then they just quit coming.
Yeah. So, but yeah, it's actually that's what I see. If you see, as always, if I see somebody who's been to a lot of chiropractors, especially for a low back complaint, I'll put $50 on the table every day of the week that they have some form of debility and they need something like this to stabilize them. So,
every time I talk about this, nobody knows what I'm talking about. They've never heard of it. Except for the ones that have been trained through the Kennedy program.
Yeah, no, I didn't know either. I'm saying I had glimpses of it years and years ago, but until get some really good hands-on training with it, no, now it's like, that's why I move a lot of these things and work with a lot of patients with them, is because it's helping a lot of our patients get better. And so, that's great, man.
So there's a reason to get a Serola belt and start using them with your patients. Very good, awesome.